is a possibility of, member countries influencing the governance within this particular institution.
They can't go to hospitals, so now the poor people have to leave their jobs and come take care of the people. So yes, they negatively affect the quality of life.
Over time, the mandate of the international financial institutions has been growing bigger.
Taxes are increased and expenditures on public goods are reduced. So they tell you, okay, so for you to be credit worthy, what you have to do, number one, you have to cut expenditure. Where do you cut expenditure? You cut expenditure on health and on education.
The most essential.
And it is possible for the Global South to actually overcome the reliance on international financial institutions.
Welcome to Regional Advocacy on Regressive Policies, Fostering Inequality, a podcast series that explores the impact of international financial decisions on communities, lives, and the ordinary life of Africans. This is a podcast series that is powered by Tax Justice Network Africa. We are happy to have you. Welcome. On the podcast today, we are happy to welcome Hannah Wambui, who is a tax consultant based in Nairobi. Yeah. And Hannah, please welcome and kindly let us know a little bit more about yourself and what you do and what keeps you going.
Okay.
Yes.
Thank you. My name is Hannah Wambui. I have a background in economics and I'm in the finance space. I've been in this space for over 8 years now. Currently, I'm in consulting as a financial and tax consultant at Finsure Advisory Limited, where we basically help SMEs and individuals stay compliant with the government. And I'm very excited to be here today to have a conversation around the impact of IFIs on developing countries. So thank you for having me.
Yes, thank you. We are happy to have you. And today our discussion is what we call structural policies and the harm that they have on communities.
Yeah.
And to just start us off, is there a role that IFIs, when they come up with new rules, and these rules end up guiding what African countries do they really play a big role in shaping the outcomes of fiscal policies across Africa?
I think they do. So IFIs like IMF and the World Bank were formed after the World War to help in the short-term and long-term financial crises through provision of loans and grants to economies that were going through this crisis. And so I believe that they have something called the Structural Adjustment Program, that is the SAPs. And these are just economic policies that are there, that are put in place to help in the stabilization and the restructuring of the economies.
Very true.
Yes, and so these SAPs, what they do is they have austerity measures that require now the countries that are getting the loans and the grants to adopt before they're given any loans. And some of these, allow me to add that some of these SAPs are like, some of these austerity measures are like governments are supposed to reduce their spending or reduce subsidies, tax reforms, especially on indirect taxes.
Very true.
Yeah. Currency devaluation, such things. And so by provision of the loans and putting of these conditions, these are some of the ways that IFIs are involved in making the reforms, economic policy reforms in these countries.
Yeah.
And when they do this, they do not just leave it at there. They also bring in experts to advise budgetary controls. They also monitor. So what they will do is that they will bring in experts who will monitor, and then they do reports, and then now they'll use these reports to advise the governments that have been given these loans, and this advice will play a part in the decision making of the countries. And after that, now the loans given to these countries allow other investors to come into these countries to provide investments in form of foreign direct investments and also grants and donors. So in that way also they attract investors. So in those ways they do contribute to the economic policies of different governments.
Yeah, and the outcome, the outcome of their influence on economic policies within Africa and what we can call low and middle income countries. Would you describe their impact as progressive or regressive?
So I think they're regressive because they most you'll see that they'll require countries to change reforms, or tax reforms rather, that are indirect taxes, and indirect taxes are regressive.
Very true.
And regressive policies mean that these are policies that heavily overburden poor people as compared to the rich people in the society. For example, when taxes are increased in things like fuel or food, you'll find that a poor person and a rich person are paying the same amount of money. But really what this is doing is that it's taking more of the poor person's income.
Very
so
true.
They suffer more than a rich person. So in that way, it's regressive in nature. You'll also find that when they come for subsidies, I mean, when they say that you need to reduce subsidies, let's say, for example, fertilizers or input taxes, inputs in like, production. So you'll find that the production cost goes high. And you'll find that the cost of living goes up. But the rich people they have the capacity to absorb these shocks, but the poor people, they only have limited funds. They do not have the capacity to buy more. And
really cushion themselves.
Yes.
Yeah. Do they have an impact?
They do have an impact because I believe that they lower the quality of lives of the poor people when they have inaccessibility to some of these things, like the health system. When a poor person goes to a hospital, but now it's no longer free, or education, they cannot access free education. So you'll find that the rich people are able to take their kids to private schools, private hospitals, but now the poor people cannot do that. You'll also find that when that happens, and let's say people are supposed to be taken care of, they can't go to hospital. So now the poor people have to leave their jobs and come take care of the people. So yes, they negatively affect the quality of life. And
if we were to flip it on the other side, and think about the impact of these austerity measures that are being pushed on African countries, and the impact they are having on unemployment. How do you look at it? Are they really contributing to unemployment, as some people are saying? Or is it just a fallacy that indeed these austerity measures are leading to more unemployment across Africa?
In my opinion, it has both direct and indirect link to unemployment.
Very true.
For example, you'll see that when there's a wage bill to reduce government spending. So that means that there's a hiring freeze. So what happens now to youths who've gone to school and
Graduated.
and they were
Are looking for a government job.
Yeah. And the government has the social responsibility to offer employment, and now they cannot do that. So that has a direct implication on unemployment. And we saw this in Kenya. In 2022-2023 IMF program, there was a wage bill. Also, privatization has a direct, or rather, has an implication on unemployment, because you'll find that when the state-owned enterprises are privatized, and now private investors come in, and they want to improve efficiency, so the first thing they do is to downsize. Again, we said the government has a social responsibility to employ many people. So when now these investors come in, they want to cut down the number of people to improve efficiency. And so, we see that they cut down the number of people. Again, poor people are unemployed. We saw that in Zambia during when the mines were privatized and people were laid off.
Very true.
The other way that it has an impact on unemployment is through reduction in subsidies. You'll find that most SMEs depend on subsidies from the government to reduce the input costs. And so you'll find that, let me give you an example in Ghana. What happened in 2013 and 2014 when the fuel prices were no longer subsidized and the cost of production, specifically in transport, went high. So people were laid off. So basically these austerity measures have a direct and indirect implication. Also, when youths do not get jobs and they start vending on the streets, when they get into, let's say you are an engineer and you do not get a job, so you go into, let's say, construction, and you're offering informal employment and you're qualified for formal employment, so you're getting lesser pay, you have no benefits, there's no job security. So in that way, there's underemployment, which is another form of unemployment. Yes. So there are many ways that these austerity measures directly or indirectly affect unemployment.
And I know you could also add something about when you think about a country that is implementing austerity measures while having a very high rate of unemployment, and how those become two twins that lead to even worse outcomes. Maybe you can speak a little bit about that.
I believe that they are doing the opposite of what they should be doing. So the austerity measures are supposed to protect the financial institutions, but they are very stringent. And what this does is that, first of all, they're supposed to reduce the fiscal deficit in the long run. But the people putting these measures in place are not seeing what they're doing in the short run, which is reducing the level of unemployment. So when the level of unemployment now balloons and it becomes very ungovernable, this now reduces the quality of life such that even in future, there are no longer jobs. So I'll say that they are not helping with the short term and in consequence, the long-term solutions, that the things that it's supposed to do, they're not doing that. So really, they are negatively affecting us as developing countries. And I believe that they need to involve things like trade unions and people down here not top down, because the people at the top, they probably do not know what the people at the bottom are going
Are
through.
experiencing.
Yeah, so I believe that there's a lot of conversations and involvement that needs to be done to actually now take care of the level of unemployment and other problems that the austerity measures bring.
Are having.
Yeah.
And the other reflection there is about the impact that unemployment is having in countries, developing countries that have a very high demographic dividend in having, a good number of youths. So the people within the youth bracket there's a big number there.
Yeah.
These people need employment. And then the same countries are implementing austerity measures.
Yeah, it's very interesting.
So it's simply, complicating
Yeah.
the issue a little bit more.
Yeah.
I'd want us to talk about, with austerity measures comes a lot of privatization and subsidy removal. But there's also the question of, does this have gendered impacts? When you think about privatization and subsidy removal, especially within the African countries. What are the gendered impacts of that?
So privatization, we say that privatization is bringing private investors in state-owned enterprises. And you'll find that the government mostly will subsidize industries that are mainly female dominated, like nurses, teachers, clerical officers. Those industries are mostly and traditionally female dominated. And so when the investors come in and they downsize, there's unemployment, and there's unemployment of the women.
Very true.
Yeah, so in this way, women are now unemployed, and it brings a gender inequality in unemployment in that way. Yeah, so that is one of the ways that privatization causes inequality for women.
For women.
Yeah.
And maybe you could also add about, subsidy removal and how that affects, the different genders differently.
Differently.
Yeah.
So you'll find that in the economy that we are in, mostly developing, I'm saying the economy that we are in because we're in a developing country, which is also a low and middle income country, you'll find that, let's say, two adult households, that is a woman and a man earning money, because there's not a lot of it, so people are going to divide obligations. And you'll find that the woman is going to be given obligations in the kitchen, that is buying food, buying the kerosene that cooks this food, and things like that.
Medical care for children.
Yeah, things like that. And then now the man is going to be tasked with the major roles of school fees and rent. And what happens when subsidies are reduced in, let's say, inputs in production of food, it means now the production of food becomes expensive, and in turn, the food becomes very expensive. And so the budget for the woman goes up. But then again, they have to also provide. So it means either they're going to reduce the quality of the food they eat, and that affects the quality of their lives. Children are not able to go to hospitals when they fall sick. So the woman is also given the responsibility to take care of these children. So in that way, privatization and reduction in subsidies do bring in the component of inequality in gender.
Yeah. And then just continuing along that same trail of thought, do regressive policies disproportionately affect women and marginalized communities? And if they do, how?
I think they do. So in the past, women have had inaccessible, or there's a barrier to accessible, decent work. And by decent work, I mean work that is socially secure, adequate in pay and rights, and one that has normal working hours. And we've seen that women have been put in a bracket of there's motherhood barrier. The society has social norms that the woman is the primary caregiver to children, and so they do not have a fair ground when it comes to providing fully their potential in the workplace.
Yeah.
And so how this also brings inequality is that, let's say, indirect taxes, when they come in, you'll find that they affect things like sanitary towels, and this does not affect men. You'll find that in 2025, there are people who do not have access to sanitary towels, and when taxes come in, it means that they have to go back to traditional methods like using of blankets, and honestly, this reduces their quality of life. You'll also find that the other inequality is that, let's say, there's a sick person in the family. Again, we've said that the woman is seen as the nurturer. So automatically what happens is that the woman will be required to stay at home to take care of this sick person, because they cannot access healthcare because it becomes expensive when subsidies are removed. Also, when education is expensive, the woman is going to, when you're comparing the boy child and the girl child, it's easier to let the girl child stay at home and help with the domestic chores, or even go to work and find something to bring home. And some people view it as, let's educate. There are some people who still view that as, let's educate the boy child because they have a better chance of providing in future for their family. And the girl child will be married off to be provided by the boy child. And so in that way, there's gender inequality.
We have seen the elimination of what we can call healthcare covers that were primarily meant to protect women when they are most vulnerable, like during childbirth, simply because we are being pushed towards less subsidies. You could also comment about that as you build your trail of thoughts.
Okay. So when there are no subsidies in the healthcare sector, it means that there's some women who cannot afford to get the care that they need when they're pregnant. There are some supplements that they need to take during this period, and when VAT is imposed on medicine, because we import some of this medicine, it means that it becomes expensive, and the women cannot afford this, so they won't have the money to buy it. They won't have money to go for clinics. So if there's something wrong with the baby, they won't find out. And it's so bad that sometimes during the actual childbirth, some women do not have money to go to hospital, so they'll give birth at home, and the conditions are not sanitary, so mortality rate increases, and also this imposes even death on these women. So in that way, it affects the woman. I'd add that I understand that there needs to be conditions to make sure that the money is used the way it's supposed to be used. But the austerity measures are doing more harm than good. And I believe that if they included people from down there, not just up, if people had more representation, if the executive boards in these in the IMF or the World Bank included people who understand what is going on, I feel like that would really help in coming up with better conditions that are not too stringent. And I also believe that if they came up with rules that are not just, especially like taxes, if you're not just looking at it from a regressive aspect, if they looked at, yes, add taxes, but add progressive taxes so that not just the poor are being affected, so that it's fair to the rich people, they pay more, a bit
fair
more.
amount of tax.
Yeah, there is a fair amount of tax.
Yeah.
And let's improve tax administration. There's a lot of evasion in these countries. Let's tighten those rules. So I feel like there are other ways around the conditions that can improve the quality of life as we continue getting the loans and the money from these IFIs.
Yeah. Thank you so much, Hannah.
Thank you
for joining us. We look forward to seeing you again in this podcast. Thank you.
Thank you very much for having me. It was a pleasure.
Thank you. Yeah, thank you for listening to Regional Advocacy on regressive policies that foster inequality. Stay tuned for more podcasts and more discussions on how global financial governance has impacts across Africa. We request you to subscribe, to share, and to follow this podcast. Thank you.